thanks J&J for this session. These are my financial interests. Start off with this concept, old ways will never open new doors. So we have to really look at how we evaluate the whole ocular surface. When we present this slide, it's not always means that everybody should buy everything, but these things are done so that we understand what is really happening. And once we understand what is happening, it's probably easier to make sense of sometimes unexpected problems. See, let me start with understanding the depth of corneal nerves, which is probably the most important thing. These are your subepithelial nerve plexus, which needs to be analyzed with software. You need to understand the proteomics and the inflammation parts of it. There's a bunch of stuff which you can actually see from the tears itself. It's about how smart your scientists can analyze and virtually can pick up everything. And this is a very old slide about how we do all this process. And finally, it's about the power of imaging the tear film itself, which is very important because the tear film actually helps us to understand the optics of the true optics of the eye. For example, this is a point spread function of your tear film from the time the first blink to the second. And if you have a perfect blink, then you can perfect tear film, then it's all in green, which means it's good. And when it's not perfect, then the entire thing changes. That means the vision is fluctuating a lot. So in refractive surgery, if you're looking at two types of patients, one contact lens intolerant, other contact lens tolerant, what we see is more or less both of them have the same kind of metrics, but one has a lot of high OSDI. The question is which surgery you want to do. So that's when we go back to the nerves and we look at, there are three important components which is always in the kind of hemostasis: your meibomian glands, your epithelium, and the corneal nerves. As your meibomian glands are good, the epithelium is healthy, and so is the corneal nerves. As your meibomian glands changes, as it keeps changing with different kinds of dropouts, and you can see that the corneal nerves also keeps changing, and that would impact your epithelium a lot. So how does it really make a difference? How does all these things make a difference to the practice? Because all this would change the way your cornea would heal, and this would change the way it would do after you do a LASIK surgery. For example, you do a LASIK surgery on the first 3 group and do a LASIK surgery on the second 3 group, which is irregular with poor meibomian glands with a lot of epithelial change. Your healing would be completely different. Your nerves would not regenerate the same way as the nerves of a healthy one. And probably this is how an epithelial would heal after you do the surgery. A perfect epithelium healing post-surgery and an imperfect epithelium healing post-surgery is a classic example of what a hemostasis of meibomian glands and ocular surface, which is very important for maintaining the health of the ocular surface. If you lose it, then you lose everything. And that changes your quality of vision. You can see that the perfect, and you can see how imperfect this quality of vision is just because of the change in your ocular surface. Same thing with cataract surgery. The epithelium is very important, and epithelium is a real indicator of how good is your ocular surface. And you can see that a healthy ocular surface from the epithelial aberration, absolutely normal, but here from the epithelial surface itself, we can see cylinders. You do a cataract surgery on them, healing would be different. And you're seeing a diopter of cylinder coming only from the epithelium. It's a very interesting concept. If you're operated on, I did see some fantastic surgery videos of Mohan sir, and a lot of you are fantastic cataract surgeons, but at the end of it, if your ocular surface is bad for your premium surgery, and your epithelium itself would induce a diopter of cylinder only on the epithelial surface, then the whole thing beats, beats the purpose. And when it actually beats the purpose, then you end up in actually having a poor quality of vision and an unhappy patient. So all these things can impact the quality of vision in many big ways. So how does thermal vector pulsation therapy, like a Lippy flow, work in these patients? We use this a lot as a pre-op cleansing, I call it, of the meibomian glands and ocular surface. The heat itself would change the constituents of the lipids, and the massage would help in expressing it out. This is what is it's been known, and we have studied the cytokines parameters. These are the ones which makes you feel happy, or makes you feel comfortable, or makes you feel irritated. And when you see all these parameters, it shows that cleansing of your ocular surface, or making the ocular surface healthier, would have a huge impact in the health of the eyes as we go on. The speedometer on the right side, which is on the red, shows that all the markers of inflammation are very high to begin with. And after you do the procedure, after 3 months, you do all of them become normal become completely normal. This is a LASIK patient, 26-year-old, LASIK for 3 diopters, complaints of blurring of vision, unhappy vision. Quantity of vision is 20/20, but quality is poor. The well center, the epithelium is good, everything is perfectly all right. But look at his tear film. His tear film is breaking up very, 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 very fast. And this breaking up fast in 4 seconds, you're going to see he sees so much of fluctuations of his tear film in 4 seconds that it ends up having a very poor quality of vision. So what do we do? There's no improvement in the treatment dose. That's when we prescribe the Lippy flow. I mean, this is again what we do for post operations. You can see the same patient who was in 4 seconds having so much of change suddenly drops down to a perfect healthy tear film. Once you have that perfect healthy tear film, your drops, what you're giving works, and then you can continue with them, or you can do a home-based heat fomentation and all the other things which we normally do. What happens we do it before and after is this is an ongoing study which we're doing. One study is before refractive surgery Lippy flow, other one is post refractive after 3 months. What we found was when you do a Lippy flow procedure before refractive surgery, or even for a patient who has got meibomian gland dysfunctions, the quality and the quality of life is definitely better, and quantity of your tear film, your T-buds, and all that OSDI, which all that complaints what comes with it, completely gets much, much, much better compared to what you do it after 3 months. So that is definitely a favorable way of treating it prior. And all your inflammatory markers also becomes completely different. And you are reducing them before the surgery itself, which gives a very comfortable post-operative period for this patient. These are just the graphs of anti and pro-nociceptive factors, which this Lippy flow can alter. The Lippy flow is just about not taking the glands and cleansing it up. It also cleans and also maintains the ocular surface milieu, and it maintains the balance of things which can cause sensation and which can cause hypersensation. We need a balance. We don't need anything to be completely knocked off, but we just need a good balance, and that's what this does. Out of box concept, we have been using it in few patients of keratoconus, because we feel that those who rub their eyes constantly, and especially before cross-linking in patients who have lots of allergy, we try to do it, and I've been quite happy. Not that it's a costly procedure, so you can't afford it, can't offer it to everybody, but those on whom I'm going to wait for a few months, or if they're somebody who's traveling out of country, I do offer them, and they're very happy with it. And they say they just stopped rubbing the eyes with this, and that's something which is a very important plus point for me. So what does it do? It reduces your itch factors. Once your itch factors goes, the whole necessity to rub goes, and then all that discomfort and other things comes down. And this is a very good example of one of our patients with keratoconus, and you can see that how stable they are, and you can see some amount of flattening also, just because you stopped rubbing, and it stabilized the whole cornea. So managing the ocular surface helps in preoperative. If you manage, it helps in wound healing. In post-refractive surgery and cataract surgery, definitely a big role. And I'm trying to work around it in keratoconus also.